Hi guys, colposcopy. What's it all about and when do we do it? What are the dyes? Explanation. Colposcopy, just to remind ourselves, is the referral pathway after a lady has a smear test which comes back as being positive. Polite reminder here, the smear test is not here to actually identify whether you have cervical cancer. The smear test is purely to check whether you have the HPV, the presence of the HPV, the human papillomavirus. Okay, the human papillomavirus. 11. So there are various strains of this. Strains 11 and 16 are the more notorious ones, which usually lead to a poorer prognosis. So remember, the HPV is very strongly associated with cervical cancers and cancers otherwise in and around the womb. So that's the reason you then refer. So a smear does not check for cancer, rather it checks for the presence of HPV. If there is presence of HPV, then what we do is we refer the patient for colposcopy. Again, brief reminder, the smear test in the UK starts at 25 years of age and it's every 3 years up to 50 years of age, after which it becomes every 5 years up to 65 years of age. And that's generally the situation there. Nice guidelines. Okay. Colposcopy is a procedure whereby we insert the speculum into the vagina and we are going to assess the external cervical os and the upper regions of the actual vagina itself. We then actually apply some acetic acid around the area, so acetate or acetic acid. Now, what we do is, if there are abnormal cells, okay, if there are abnormal cells. Now, what I mean by abnormal is cells which are replicating. In the context of, so just to remind ourselves, in the context of cancer, cancer is a process and a tumour is the end product of this process. So a tumour is a group of cells that have produced uncontrollably, they have cloned undergone mitotic divisions uncontrollably, okay, and that leads to that mass of cells. Cancer is the process by which this happens. Now, these cells that are growing uncontrollably are growing at a faster rate than they would otherwise do. I'm not going to go into the technicalities, tumor suppressor, proton genes, you can look at that for yourself, but the point here being, these cells are growing at a faster rate than they would, so therefore they're abnormal cells. The cell membrane on these guys is actually inefficient to carry out its purpose in its entirety. What I'm trying to say is that the cell membrane is fairly disrupted. Then what happens as a result of that is when you apply the acetic acid actually goes through the cell membrane of these abnormal cells, and it binds to the protein components. Okay, the protein components of the cell. Now, the protein components in a cell are essentially the genetic material found inside the nucleus. So we're referring to the DNA. What happens is the acetic acid coagulates these protein components, and that coagulation, it is what causes the staining in the context of acetic acid. So acetic acid causes staining due to coagulation of the protein components of our cell. This only happens in abnormal cells because the cell membrane is inefficient, it's defective to carry out its function as it would otherwise. As a result, acetic acid leads to staining of abnormal cells. The reason I'm stressing that point is because there's also iodine. So I use iodine solution as well. Why do we use iodine solution? If you wanted to, not always, if you wanted to, that is. The reason for this is, again, in a similar situation. So the normal cells contain a storage of carbohydrate molecules. So remember, starch, iodine, is a test for starch, back to GCSEs. So what happens is, in your normal cells, there's a good amount of starch, so don't forget glycogen reserves, etc. The iodine is going to pass through the membrane in this situation and stain the starch. And therefore, in the context of iodine stain, you get staining of the normal cells. Okay, same process, or otherwise, but the abnormal cells do have an insufficient storage of starch, again, because they are defective due to the excessive growth rates. So I hope that was helpful. That's your colposcopy, and that's your two stains that we use in the setting of a colposcopy clinic. and the explanation as to why it is that in acetic acid you get staining of abnormal cells, and in the context of the normal cells staining in using iodine solution. Thank you very much for listening.